Hello everyone, welcome to this episode of White Coat Wednesday. My name is Savannah Dennis and I'm a third year at the University of Queensland Ochsner Clinical School. Today our guest is Josh Strobel, the president of the Radiology Student Interest Group. Josh, would you like to introduce yourself?
Yeah. My name is Josh Strobel. I'm from Rexburg, Idaho. For undergrad, I went to Creighton University in Omaha, Nebraska, and I'm a fourth year medical student at the University of Queensland Ochsner Clinical School.
So Josh, can you tell us how you initially became interested in medicine?
Well, I initially became interested in medicine because I served a 2-year mission trip in the Czech Republic.
Wow.
And while I was there, I learned that, the greatest joy I could ever have is serving other people. And so I really wanted to pick a career where I could care for the physical, mental, or spiritual health of other people. And medicine has fit that for me in so many ways because I can really care for people and give them a better quality of life and well-being than they could ever achieve by themselves.
Wow, that's really fantastic. So with all the choices that you had for medical school, what made you originally want to apply for Ochsner and then end up selecting University of Queensland Ochsner?
Well, my brother originally attended the University of Queensland Ochsner Clinical School 2 years before I ever applied. So I sort of knew about the program already from him. And it's sort of become like our family school. We discuss it every day and talk about, what we like most about Australia, what we like most about New Orleans. So originally it's that family connection and knowing about the school was what brought me to here.
Awesome. So how did you decide on radiology then for your interest?
Well, it took me a while. I think I was in my third year of medical school when I started looking into radiology. My uncle's a radiologist, so that sort of piqued my interest at first. But I began to realize in my third year that radiology is really the future of medicine because it helps patients in less or even non-invasive ways of figuring out what's wrong with them. And just that future of medicine and also me wanting to be involved in, creating the differential diagnosis and trying to help other people figure out what's wrong with them. And my love of anatomy, that's sort of what was the biggest factor in drawing me towards radiology.
Okay. So would you like to tell our audience more about the interest group you're involved in, so the Radiology Student Interest Group?
Yeah. So the Radiology Student Interest Group is a fantastic organization because it's created an environment where we can learn about radiology as students together. Radiology is a unique specialty in that you don't get much exposure to it unless you're looking for it. And so our interest group has given us an area where we can push that interest together and promote it and network with other radiologists at Ochsner. So that's what our group has to offer. And we have many activities like the symposium. Every year we do a Southeast annual interventional radiology symposium that gathers in schools from all over the place. And we get a chance to meet other program directors and just explore that interest so much more.
Right. That's awesome. And how has your involvement with the Radiology Student Interest Group been beneficial for you as a student?
Well, for me, it's just given me a space where I can, develop that interest in radiology. And it's given me a place where I can have more time to learn about radiology. Specifically, networking is really important in medical school when you're trying to figure out what you want to do. And I think the interest group has helped me connect with, say, the program director of Ochsner, radiologists in many different fields or subspecialties within radiology. So I've really loved this interest group here.
Yeah, that's fantastic. And now, looking back on your time in Australia and New Orleans, would you choose to come to this program again?
100%. I really love this program, and I think it's one of the most unique programs in the world because we get to spend 2 years in another country, and just being a doctor, that's a rare and unique experience. We'll never get a chance to live 2 years in another country and learn like that. And so I would always, choose the UQ Ochsner program again.
That's awesome. And what about your future plans? What are you hoping to do after you graduate?
So we have the unique opportunity, I guess, that we graduate in November and we apply for the match and we don't start until June. So with that time, of course, I'm going to be preparing for step 3 and I'm also going to enjoy the time and go on a vacation to Russia with my family since my wife is from Russia.
Oh, that sounds really nice.
Okay.
So Josh, tell us, what has it been like having a family in this program?
Well, originally I thought it was going to be difficult because we had a 2-year-old daughter at the time. I'm married, and we thought it would be difficult to move over to Australia. But with the help of the program, it was really easy. And thankfully, Australia is a very family-friendly city, especially Brisbane. Brisbane is a very family-friendly city. There's always activities for families to do. There's a beach in the middle of the city, a man-made beach, and there's so many activities to do. I really liked Australia as a family because we could travel so many places. It was always warm, always things to do. And most importantly, we felt like we had friends and people around us that could care for us. And uniquely, in our program, we're put into groups called CBL with 10 other students, and those 10 other students become like family. They help you in all different ways in learning, but also with your family life. And so the school is just designed to promote sort of a family-like atmosphere. And so it was very welcoming to my family.
That's great to hear. And just as like a fun side question, what was the most fun experience you had as a medical student in Australia?
So I would say after our first year, we're able to do observerships. So an observership is, it's a 4-week training in a field of our choice. And so it's just an early exposure to clinical activities as a medical student. And so I chose one in pulmonology in the Sunshine Coast. And if you haven't been there, it's a great place and you should Google it because it's a chance to be 2 blocks away from the beach and also be at the Sunshine Coast University Hospital.
It's pretty nice.
And so for 4 weeks I was there, and I would go from 8 to 5, at the hospital, and then afterwards I could go to the beach and do a barbecue with one of their fancy barbecues in Australia. And so I love that opportunity because we got the best of the culture of Australia, but also we got clinical activities that were very important in promoting my, clinical awareness of medicine.
Well, that wraps up this episode of White Coat Wednesday. My name's Savannah and this is Josh, and thanks for joining us. We hope to see you next time.